The whole premise behind the Central New Hampshire Opioid Response Program is to save lives. When it comes to addressing the opioid epidemic, it really takes a village.
Ever since the beginning of the program, we really listened to the community and to different stakeholders. And what they told us was that two things: that they needed to know where to go when people needed help, and they needed it to be easier. So we came up with this thought of having this no wrong door system of care, and sort of being that convener for all the different players in this realm.
We're really looking for those firsthand accounts in the community of how substances, specifically opioids, are impacting our youth, our families, and the community as a whole. Then we're pulling our partners together to hear those stories, to look at the data, look at the research, and determine what solutions are needed to address the problem and to identify what is attainable at the local level.
Our corp is sort of the convener, the connector, and we span across prevention, treatment, and recovery services. For example, PARC would be if somebody is looking for recovery or intensive outpatient treatments. And then we also have SPEAR, which is obviously acute care, hospital-based, which would be in the treatment bucket. Katy falls in the prevention bucket for youth prevention. Mid-State Health Center, acute outpatient care, would fall in the treatment bucket. And then we also have Lakes Region Mental Health Center, and they fall in the mental health behavioral care.
And I mean, when it comes down to it, the work is all about relationships. And since 1999, Katy has been working with a diverse network of partners in the community and volunteers with the goal of preventing youth substance use and reducing use across the gamut.
People didn't know where to go when they needed specific services. And that's actually why we did develop FindWell, which is findwellnh.org. And that is a prevention, treatment, and recovery locator for the Central New Hampshire region. So an individual goes to that website if they know what they are looking for. Say they know they want prevention for their children, then they're going to click on the prevention section and they're going to get pointed to Katy. If somebody is going there and they need medication-assisted treatment, they're going to click on treatments. They're going to get Mid-State. If it's an emergency, they're going to get SPEAR. And then, of course, if they need recovery services or mental health services, they're going to be directed to PARC or to Lakes Region Mental Health Center. And there's also a contact on there if they need help deciding what they need, that they can either email or call us, and we will help navigate them through that system.
So through this collaboration, we are able to connect the dots across the continuum of care. So whether somebody is coming to a partner for prevention, you know, that partner might not be the right source of information. However, because we're working together, they know what door to send that person through. I'd say this is a true community effort, and whether you are a prevention, treatment, recovery organization, or you're a parent, a concerned community member, if you're a grandparent who's raising your grandchild, or somebody who's in active recovery, we really want involvement from everybody in the community, anybody with a passion to make a difference.